Tanaiste, again we read today that the people who have health insurance are now facing a further 15% hike in their health insurance premiums from the 1st of July. This means now that the average premium for 2 adults and 2 children will have doubled in the last 3 years to €2,500. This is a result of legislation that's coming in July, will be responsible for the hike that's about to come in. The government wants to raise about 60 million and wants to charge the full cost for private patients using the public health system. In essence, it's putting an unsustainable burden on individual families. People pay their taxes under the 1970 Health Act. They essentially are entitled to treatment in acute hospitals. They pay a second contribution through health insurance. The problem, Tanaiste, is fundamentally that the continual price hikes are threatening the sustainability of the health insurance market. I mean, the Health Insurance Authority estimate that 90,000 will leave in 2014, 68,000 left in 2012. About 6,000 a month now are leaving the health insurance market. And because we have a community rating system which depends on younger subscribers cross-subsidising older users of the system, it's clear that the younger members are not taking up the premiums or are leaving, and that this is placing huge strains on the sustainability of the health insurance market itself. Now, that's in the context of a universal health insurance model, or the Dutch model, that was proposed by Minister Riley and indeed the Taoiseach before the last election. We are nowhere near the realisation of that. No white paper has been published. And what I want to put to you, Tanaiste, do you accept that the situation is not sustainable, that the cycle we're now in is a cycle that essentially is the beginning of a cycle that could spell the death knell for the private health insurance market? I'm not saying that. I think analysts are saying that. The Health Insurance Authority are putting out warnings in relation to that. And that something has to happen in terms of the overall plan to intervene, in essence, to stop what is, in essence, a death spiral in the health insurance market.
Well, first of all, what is being proposed is that the cost of a public bed in a public hospital should be chargeable to the insurance company where there's insurance involved. As we all know, the private health insurers charge for everything: the consultant, the anaesthetist. They'll charge for the bed if it's a private bed, but the hospital cannot charge at present for the use of the public bed, and that's what's being proposed. The amount of money that it is proposed that will raise is, as you say, 60 million this year, against a total payout by the insurance industry of 2.2 billion. 60 million does not amount to a 15% increase in premiums, even if it were passed on. So, I think there is great exaggerated statements being made about that. The government, as you know, is undertaking a major reform of the health services to reduce the cost of delivering these services. And the Minister for Health will shortly bring forward his proposals on hospital groups, which will streamline services for patients. And Minister of State White is overseeing a chronic illnesses programme, which will see patients treated more cost-effectively in primary care settings rather than expensive hospital settings. We're doing this also while having, of course, to reduce the budget for the health services due to the state in which you left the country, Deputy Martin. Private inpatients in public hospitals are subject to maintenance charges that generally range from €586 to €1,046 per day when they are accommodated in a private or a semi-private basis, and this charge is separate to the private consultant fees which a patient also pays. About 20% of beds in public hospitals are designated as private beds. The other beds are designated as public beds, with the exception of a small number of beds which aren't designated. If a private designated bed is not available and a private inpatient is accommodated in a public bed, the maintenance charge is not levied. As a result of this practice, hospital maintenance charges are not payable by private inpatients occupying public designated beds or non-designated beds. So the change that is being proposed and which is in the draft legislation which is coming forward is to provide for the charging of the public beds, and I think that makes sense. I mean, if the hospital can charge for the private bed, it ought to be able to charge for the public bed, which is rather than having the entire cost of that fall on the taxpayer.
Public hospitals have always been charging health insurance companies. What's proposed now is at the full cost. But the problem has been done in a vacuum and without any overall solution coming forward in terms of the issues that face the funding of the overall health service. I mean, people pay their taxes. The average health insurers are taxpayers. They're not super wealthy people. They're average families that have taken out health insurance. That's been a tradition. It's been part of our system for a long time out. And many people will be very surprised that your description of the price hikes has been exaggerated. I mean, this is the third hike now that will happen this year. I mean, people are feeling it out there. They'll be amazed at the idea that somebody thinks that the price hikes in health insurance are somehow exaggerated. I mean, 6,000 people are leaving a month. 90,000 will leave between now and 2014. 68,000 have left in 2012. And the question I asked you is that because the sustainability.
Sorry, the Tanaiste will reply.
With respect, Minister Rabbit.
Just make your point. Thank you.
Leader's question. You were leader once. You're not
Thank
now.
You. Yeah,
I would appreciate that I'd be allowed to ask the Tanaiste question.
Thank you.
Because the people were promised that there would be a universal health model introduced. Right? They were promised the Dutch model. We haven't even had a white paper in relation to that. People were promised the sun, the moon and the stars. This would be a painless approach to accessing health services and to funding of health services. The Dutch model was held out as the great sort of solution to all our ills. And we still don't know whether people who have health insurance now will be paying less under the Dutch model, or people on medical cards will be paying more, or people, the 20% who have neither health insurance or the medical card, where do they stand? But in the meantime, the centre cannot hold Tanaiste, is the point I'm making. And I'm not saying this alone. The Health Insurance Authority are warning that the sustainability of the market is at risk. The other analysts are also saying that the market is heading into a death spiral because of adverse selection risks. Essentially, younger people are leaving in their droves. They're not there to cost-subsidise older members of the health insurance market, and we are heading into a significant downward cycle. That needs to be addressed. And all we've been told is it'll be 2016 or 2017 before we can even contemplate the universal health insurance. So I think there's a genuine issue there that demands some meaningful, substantive response as opposed to just the politicking that goes on.
Tanaiste, your reading has improved since you went into opposition.
Tanaiste, please, to reply. Thank you.
First of all, I did not say that the increases in health insurance premiums are exaggerated. That's not what I said. I think the increases in health insurance premiums are staggering for families, and I think that there is a huge issue in relation to that. What I said was that the charging for the public beds in public hospitals, which is being proposed, which will yield 60 million this year, on a total payout of 2.2 billion in total by the insurance companies, no matter how you do the sums, does not amount to a 15% in premiums. And I'm saying that those who suggest that are exaggerating the impact of the effect of the charging to the insurance companies of the cost of public beds. That's what I said, and you choose to twist that obviously to make a political point. But let's be very clear about what I did say and what I am saying. I think that there are issues that have to be addressed by the insurance companies. I think there are issues relating to their cost base. I think there are issues in relation to the very high level of other charges which are charged to the insurance companies, including hospital charges and including charges by professionals and so on, which I think have to be addressed. And I think anybody who gets a bill from a health insurance company knows this full well. Secondly, I disagree with my colleague, Minister Rabbitte, that your reading has improved. It hasn't, because on the 15th of February, Minister Riley published a paper on pathway to universal health insurance, contrary to the claim that you have just made, which provides a comprehensive update on the progress achieved to date and set out the main actions. It doesn't matter what you call it. It doesn't matter what you call it. What it does is that it sets out the progress that has been made to date and the main actions that is to be done. Policy paper on money follows the patient was recently published. The government is making progress on the policy of implementing universal health insurance, and incidentally, it was never claimed that it was something that could be introduced overnight. The transition to universal health insurance is a policy and a programme which is going to take time to achieve, as you well know.
Thank you.